Ready? Okay. So first, I'm going to start off by being in the nursing station. I'm going to compare my physician's order to my MAR. And while I'm doing this, I'm checking the patient's name, the type of medication, the dose of the medication, the route of the medication, and the time of the medication. I'm also going to assess for the patient's allergies. They have no known allergies. And from that point, I'm going to get my medication, and I'm going to look at it, make sure it's not expired. I'm going to make sure it's not discolored. And so I'm going to compare my medication to my MAR, and we have ondansetron ordered is 4 milligrams, but we're going to be given 2 milliliters of it. So I compared it to my MAR. From that point, I'm ready to go to my book. So in the book, we got to make sure it's a safe dose. So the book states the usual dose, 3.15 milligram per kilogram of body weight doses up to a maximum of 16 milligram per dose. So it is a safe dose. Dilution. On the book states dilution is not required in adult and pediatric patients when given as an IV injection for the prevention of postoperative nausea and vomiting. Compatibility. In the room, we have 5% dextrose hanging. So I'm going to flip to the back of the book to make sure it's compatible with that. So ondansetron, dextrose, 5% dextrose, it is compatible. The rate of administration, the book states a single 4 milligram dose over at least 30 seconds. 2 to 5 minutes is preferred, but I'm going to give it over 2 minutes. Precautions, we're going to monitor and observe the patient closely. We're going to teach the patient to ambulate slowly to avoid orthostatic hypotension. We're going to monitor for signs and symptoms of a hypersensitivity reaction, which would be chest pain, dizziness, dyspnea, fever, flushing, hypotension, nausea, pruritus, rash, rigors, and urticaria, which are hives. And again, with the patient education, we're going to teach the patient that this medication may cause dizziness or fainting. So teach them to request assistance to ambulate, and teach them promptly to report difficulty breathing, tightness in the chest, or wheezing. The most common side effects reported are diarrhea, fever, and headache. And that's it. So from this point, I'm going to perform hand hygiene. And I'm going to perform hand hygiene. Now I'm going to prepare my medication, my equipment, get it together. So I got me an alcohol pad, got my medication, I got my syringe. So we're giving 2 milliliters. Well, I'm going to scoop it every cabbage. Before I do any of that, I'm going to close the hood, clean it. Go back in. Right. Okay, so we got 2 milliliters. Okay, so now I'm going to scoop it and recap it. And I'm going to label my medication. So the drug name, ondansetron or Zofran. The strength that we're giving was ordered 4 milligrams. Expiration date 2021. So I label it where you can still see the number of the milliliters that we're getting. So from this point, I'm ready to go to my patient's room. I got my physician's order and my medication. I got it labeled. Okay. So I go into the patient's room. I introduce myself. My name is Akia Coleman, and I'll be your student nurse today. I use 2 patient identifiers, the patient's name and the date of birth. They state that. I ask the patient, do you have any known allergies? The patient says no. So from that point, I'm going to explain the procedure. The physician has ordered you to get an IV push of Zofran or ondansetron. And patient teaching with this is that this medication may cause you to have dizziness when rising, so slowly rise, or if you need assistance to ambulate, just use your call light and we'll assist you with that. And from this point, I'm going to perform hand hygiene again. Now I'm going to assess the patient's current IV line, and with that, I'm looking at the site, making sure it's not red. Ask the patient, is it causing you any pain? They say no, so that's good. So then I'm going to make sure that it's patent, so I'm going to lower the primary fluids, and when I do this, I get good blood return, so that lets me know that the IV line is patent. Okay. So from this point, I'm ready to administer medication. And if I was giving it as into an INT line, I would have on gloves. So since it's an IV push, we're going to administer into the port that's closer to the patient. So I'm going to scrub the hub vigorously for 30 seconds, and then I will let it dry for 30 seconds. And so I said we're giving 2 milliliters over 2 minutes. So I'm gonna start now. Okay. Put this in the sharps. So from this point, I'm going to make sure the patient tolerates well, make sure they're not experiencing any itching, burning, or having a type of rash or anything. And so from that point, I would perform hand hygiene again. again. So this completes my IV push video.